Our next guest has been awarded several accolades at United Healthcare, including the prestigious Innovation Award. She earned a Bachelor of Business Administration and Accounting at the University of Georgia and is a certified public accountant. She is Vice President of National Strategic Partnerships for United Healthcare's Care Modernization and Innovation Organization for more than 20 years. Please welcome Lisa Barrett.
Thank you, Commander, and thank you all for the warm welcome this morning. It's an honor and a privilege to speak to you today on behalf of United Healthcare and our alliance with the American Legion. What a wonderful organization this is. Our company appreciates your service to this great nation, and I personally appreciate it as well. And I'm really, really excited to be here with you today. Every one of you, when you served, had a mission, right? Probably more than one mission. But our mission at United Healthcare is to help people live healthier lives and to help make the health system work better for everyone. Those are two very lofty goals, and we strive to achieve those every day and every interaction we have with those whom we're privileged to serve. I'd like to share with you today two areas of focus that excite me personally and keep me going back to work at United Healthcare every day. I get to work on this exciting healthcare transformation and social determinants of health every day. So as I said, the first is social determinants of health. The second is health system transformation. So I'd like to give you a couple of personal examples about these ideas, and then I'll explain exactly what I mean by social determinants of health and health system transformation. Now, I'm not a veteran myself, but I am the child of a father who became a Marine at the age of 17. He was one of 11 children growing up in a sharecropper family in rural Georgia, and I think a lot of his siblings served in the military because they wanted to change their lifestyle, if you will. So I had three uncles who served in World War II. One drove a Higgins boat onto the beach in Normandy. I had another uncle who served in North Africa and in France in World War II. And then, as I said, coming back to my dad, so I'm very proud of that heritage that I have coming from a family of those who served. So my dad, at the age of 17, he joined the Marines. He actually got his GED when he was in the Marines. He trained at Parris Island, and then he was shipped off to mainland China shortly after World War II. And then, after he served his tour of duty, he was honorably discharged, and he came back home to Georgia, and he worked for a local company transporting gas. Then he learned a trade. And then he ventured out on his own and started a heating and air conditioning business. Now, I lived in rural Georgia growing up in the 60s, and I remember as a child watching him in his shop. He used a manual brake to form sheet metal into gutters. That was one of the things that he did in addition to installing heating and air conditioning. But another thing I have, another vivid memory I have, was one time when a chainsaw got away from him, and it sawed his leg all the way down to the bone at the knee joint. And what I remember most about that incident is that he never went to the hospital or to the doctor. We couldn't afford hospitals or doctors, and I'm pretty sure we didn't have health insurance. So he doctored on the wound himself until it finally healed months later. I share that story with you because it's a keen example of how social determinants of health influence a person's health condition and health outcomes. So more about social determinants a little later. Let's shift gears a bit to health system transformation. My husband and I have 7 millennial children. They range in age from mid-20s to early 30s, and 3 of them are married. So we're sort of like the Brady Bunch, only bigger. Many of our kids' friends served honorably. Many of them have been deployed to the Middle East because of the age range that they are after graduating high school, and many of those men and women never came home. The ones who did almost always have a severe case of PTSD. One such young Marine veteran that I know is struggling with PTSD, anxiety, depression, and I'm sure other things, maladies of war that I would never even be able to imagine. He's in his early 30s. He struggles to keep a job and a roof over his head. He's trying so hard, but he desperately needs the health system to work with and for him. Health system transformation. And then I have a third perspective on the health system and issues that gives me an insight as to how much clinicians, doctors, nurses, any clinician They want to help provide the best care possible and the most effective care possible, but oftentimes they're strangled by the healthcare system itself. You see, my deceased husband was a physician. In fact, he served part of his residency attending to patients at the Carl Hayden VA hospital just up the road. So again, a perspective on health system transformation. So why is United Healthcare focused on social determinants of health? Well, United Healthcare is a health care company, not just a health insurance company. And here's some of the reasons for our focus. First, social determinants have a bigger influence on health than clinical care. In fact, 60% of a person's health is driven by social, behavioral, and environmental factors like education, income level, race, ethnicity. Wow, 60%. 60% of your health is determined by what you do and where you are outside of the doctor's office. So just think back to the example of my dad and you'll see what I mean. We hear a lot about health disparities and health equity in the news these days. Social and environmental factors drive these health disparities. Environmental factors like access to education, employment, do you smoke, do you live in a building that has asbestos? All of those types of things affect health outcomes. Another reason that we're focused on these is that unmet social needs are associated with a higher degree of utilization and healthcare cost. So studies show that people that report food insecurity or don't have access to transportation are more than 2.5 times as likely to report multiple emergency department visits than those who do have access to those things. And they're more than twice as likely to experience a hospital inpatient stay. Wow, so unmet social needs put an extra burden on the health system. So last year in 2020, United Healthcare screened about 2 million members for health-related social needs. And what we found was that more than 1 in 3 of our members reported an unmet social need. That's a third of our membership that we surveyed, and those are just the ones we know about. We also found that our stakeholders, like our employer groups that we insure, our state and federal governments, and even our members want our help with unmet social needs. But most importantly, addressing these social and environmental factors represents our greatest opportunity to help people live healthier lives. And what did I say? That was our mission, right? Helping people live healthier lives. Now, as you might imagine, COVID has exacerbated these social determinants and the health disparities they cause. So what is United Healthcare doing to address these issues? Well, first, we've invested over $500 million in affordable housing units in underserved communities across the country. Second, to help ease the burden and aid in recovery from the effects of the pandemic, we donated $12.3 million through our Empowering Health grants to community-based organizations, many of whom are veteran organizations across 21 states. And then third, the United Health Foundation has also donated $1.5 million to Feeding America, which is the network of member food banks. And we did that because of the troubles that they were experiencing as a result of the COVID pandemic. We also have invested $1 million into Meals on Wheels America to support local programs that address the immediate needs and the ongoing needs of our vulnerable senior population. We've partnered with local community-based organizations to distribute more than 47 million meals since 2018. Now, as proud as I am to be a part of an organization that invests in vulnerable communities by providing food, providing housing, why should any of this matter to you as an American Legion member? Because veteran status is an important social determinant of health. So think of it somewhat like gender or race. It's a part of who you are, right? The part of you that has had a military life, it stays with you and it's part of your life story. It affects your view of yourself and your view of the world, and it might impact the kind of care that you need to consume or where you may receive that care. Knowing that a person served helps us at United Healthcare to better serve the veteran. So how do we do that exactly? At United Healthcare, we are linking United Healthcare veterans with 8,000 or more veteran-specific programs and an additional 1,800 veteran spouse programs that provide assistance to those who have these social determinant barriers to health. We've seen great progress in connecting our veteran members with resources to help them live healthier lives. So that's the picture about social determinants of health, as well as how we're assisting our veteran members in this area. Now, what about health system transformation? The United Healthcare vision is to deliver the most affordable coverage, the simplest experience, and the highest quality supported care. Now, how do we intend to deliver on those promises? First, let's talk about the affordable coverage. Affordability is the cornerstone of any sustainable healthcare system, and we all know that right now our system is not sustainable because it's not affordable. But we're making healthcare coverage more affordable by attempting to take costs out of the system in ways like focusing on new consumer-centered product design, which make access to care more easy and affordable. We have supportive clinical programs that keep members healthy and reduce the need for costly treatments and hospitalizations. We're reducing our administrative cost and our back office simplification. We want to guide our members to the best site of service because that's going to help reduce costs and improve the quality of the care that you receive. Trying to negotiate better unit costs with our providers to lower overall cost, and then designing innovative networks focused on premium designed care, providers to those who offer high quality, more efficient services, and the one we all like to talk about, making pharmacy costs more transparent for members. The second thing we want to do is to offer a simpler experience. I'm sure you've experienced the healthcare system. Maybe you've had an issue getting a claim paid, or you can't get an appointment at your provider's office. It can be complicated, and we're trying to make coverage easier to use, meeting each person's needs where they want to be met on their terms, not on our terms. We can partner with care providers to make it simpler for them to work with us and to care for the health of their patients. So we're doing that by bringing care to the member through easier to access telehealth options and home health services that guide members to the right provider. Investing in digital tools and virtual care plans, connecting different points in the system through a tool that we have called Point of Care Assist so that the information flows better through the system. It enables patients to receive much of the care they need in the comfort and safety of their own home by providing digital access to therapies that support both physical and behavioral health. And then third, we want to offer high-quality supported care. We're transforming the way care is delivered, supporting members at every step in their healthcare journey. Powered by technology and data and analytics capabilities, we can enable the delivery of better health outcomes while also reducing the overall cost of care. There are many ways that we can do this. As I mentioned previously, we're expanding provider relationships that reward for value, broadening our view of health care, and investing in these areas like affordable housing and food security. Combining data and technology to promote the use of high-quality providers, improving quality of our provider network and care for our members. And then focusing on complex and special needs cases, providing a human touch, advocating for our members at every step of the journey with programs we have such as Advocate for Me and Navigate for Me. Again, these are lofty goals we've set for our company to transform the health system. But again, what does that have to do with our alliance with the American Legion? Well, for me, it's simple. We both have a common goal and a common mission to take care of veterans by providing holistic care. The Legion is not just about shared fellowship between members, it's also about passionate advocacy for veterans' well-being and lifting each other up when there might be adversity. We all know that veterans have unique health care needs that go beyond routine care. Maybe they have a physical challenge related to their service, such as a traumatic brain injury, vision loss, hearing loss, a spinal cord injury. And I'm going to go back to my dad again. He didn't have a spinal cord injury when he served in the military, but when he was in his 50s, he had a motorcycle accident that left him a quadriplegic. And the fact that he had served in the Marines allowed him to be cared for at the Veterans Hospital in Augusta, Georgia. And I will forever be grateful for that great care that he received there. And that's just one example. It may also mean that veterans have mental health conditions and needs like substance use disorder, PTSD, depression. So caring for veterans may also require all these wraparound services that I talked about that help address all of their needs, not just their physical needs. United Healthcare and the American Legion are working together on our common mission to provide holistic care to veterans. I believe that our corporate alliance will strengthen us in addressing all of a veteran's health and in transforming the health system for veterans. When veterans are properly supported, it's a testament to their value and an acknowledgement of their commitment to the service of their country. Increasing and simplifying access to care and essential support services may help these servicemen and women, no matter how they served, achieve lasting wellness. And that is really the end game, lasting wellness. I want to thank you for your time and attention today. God bless you.